I get a call, third floor to one of these tenement houses. I go upstairs with my Narcan, and there's 911 talking to a 9-year-old on how to do CPR on his mother that he just found. And then you're looking over to the kid and he's eating his Cheerios. Mother's, we're working on his mother and he's just getting ready for school, like he does every day. Early in 2014, we realized that we were dealing with a pretty significant issue here in the city, and that was what I consider the start of the opioid crisis here in Manchester.
I would say in the past 4 years, the amount of individuals that I've been directly connected to, just from people who have come through our treatment facility that we've lost to overdose, it's monumental. Serenity Place is a community-based treatment agency here in downtown Manchester.
We quickly went from an average of maybe 30 overdoses to 60, 70, 80 overdoses right away, and it hit us like a shot. We opened up our 10 fire stations to anybody seeking help with the disease of addiction. The press will come to me and they start talking about Safe Station, and I'm like, we're just the access point. This work is happening in offices like Dr. Sue's and Serenity Place.
So we really rely on a lot of community partners because we don't have medical staff that work at Serenity Place. We rely on providers in the community such as Dr. Sue.
Nobody chooses to be an opiate addict.
That was always a mission of this practice, is to help people in the community who needed specialty services.
My goal's always been treating each patient at a time and serving the community that's right next to me.
We often connect with Dr. Sue to help with that.
One of the places I personally work with are pregnant heroin patients. A lot of those patients we do give medications to for addiction, and the program has really grown. That's one area I'm particularly proud of.
I think that's why they own private practices. Your tendency is to help, not necessarily thinking about dollars and cents.
Today, I'm really thankful that I partnered with Greenway to work on revenue cycle management. It has brought my practice to a level where we can now work on practice development, where we can look outside of the office and see where our providers can help the community in fighting the opiate crisis. The most immediate challenge at New Era Medicine was billing. Revenue cycle management did not exist.
We were able to basically tell Becky, empty out all your drawers, scan them all into me, let me figure it all out, and we'll get a plan.
Because we teamed with Greenway Revenue Services, we were able to focus our staff on eligibility, copay collection, something that had not happened here prior.
Greenway this year did a huge cleanup and spent a lot of time with us personally. Greenway has a personal touch. I feel like when it comes to communicating with our staff and making it easier for us to communicate with patients when it comes to billing questions or medical questions.
And it was definitely not a smooth transition either, because it was 2 years of kind of not having the best revenue cycle in place. I think Greenway had a lot harder start. I found that Greenway has done well.
I love the templates in the program. It makes it much easier for me to get my notes done quickly. And that's really important for any provider, nurse practitioner, doctor, to be able to put in the values that we need to move through the patients, because we see high volume.
The main thing is, I always say, Greenway will stick with what they're saying, and so, it's been proven the last year that the Greenway actually did a great job in the revenue cycle management.
I love working with Greenway because I know I can pay my staff, buy equipment we need, and when you are expanding your practice, you need to have that cash flow coming in, and there's not a problem. And if we're not doing something right, they tell us how we can do it better. The
practice has shifted a little bit. Before, it was myself, a small practice. Part of the reason going with Greenway Revenue Cycle was that Jen Real has expressed interest to carrying on after I retire.
I'll see clients that I've seen come through, and they end up with New Era.
It's not always negative, because there's clients who come in who I've probably seen at the worst moments in their life, and then I'm holding their baby and they've been in recovery for 2 years. There's a lot of people in the community who recognize that need and are filling that need, such as Dr. Sue, to take the appropriate steps to partner with agencies like ours.
I think that now, Greenway has the right customer service kind of focus, which is what we focus here.
A lot of success stories, a lot of families getting reconnected. So do your best,
Greenway is all about improving the ability of the providers to provide care for patients and give information to the community. We both have that similar value.